Hey guys, welcome to another episode of Brain Buzz, where we delve into the fascinating world of neurosciences and brain health. I'm your host, Dr. Kimon Bekelis, and who are you?
I am your co-host, Jason Wallen.
All right, awesome. So today, it's a really exciting day because we're welcoming a new member in our team. So as you guys know, we've been talking a lot about the Stroke and Brain Aneurysm Center of Long Island and all the great things that have been happening here in Suffolk County in neurointervention, treating strokes, brain aneurysms, diseases of the brain and the spine when it comes to the blood vessels. But we are expanding, and the expertise that's been created over time at Suffolk County, we're bringing it with some of the most talented people in the region and in the world to Nassau County. And part of that expansion, I'd say the first component of that is Dr. Sundeep Mangla. He's here with me today. Sundeep, welcome.
Thank you, Kimon. Thank you, Jason.
All right. So I'm sure you'll be on our podcast a lot more in the future and in some of our educational videos. But the main thing that you'll be doing, working with us, will be clinical care, right? Taking care of patients.
Yes, that's the primary mission.
The primary mission. So what do you do?
Well, for the last 25 years, I've been, basically developing, clinical programs for stroke, ischemic and hemorrhagic stroke, and I specialize in endovascular treatment of these conditions.
Great. And so what Sundeep is really saying is that he can go into the brain with the smallest hole in your groin or your wrist and make it into the brain and change the outcome of a devastating disease, right? Brain aneurysm, strokes, everything that we've been talking about. And of course, he would treat stroke, brain aneurysms, arteriovenous malformations, moya disease, carotid disease, all the cool stuff that we do on a daily basis. And so, of course, you said over 20 years you've been doing this on Long Island, and I know
in New York City, yes.
And New York City, right. And you've set up a lot of programs beforehand. Tell us a little bit how this whole thing started. Tell us about your education and how'd you end up on Long Island? Really?
Sure. Yeah, no, I grew up in Cleveland, Ohio, in the suburbs of Cleveland, and went to medical school and undergrad at a 6-year medical program out in Ohio, and developed a lot of interest in neuroscience. Did research as an undergrad and explored neuroscience in medical school, and then basically gravitated towards neuroradiology and neurointervention. During my residency in Ohio. After that, I did fellowships in diagnostic neuroradiology at USC in Los Angeles, and then in my interventional fellowships at Yale and University of Iowa. Where this was back in the late 90s,
Wow.
and so this is when, neurointervention was still just starting to, pioneer new approaches to treating, stroke and brain aneurysms.
Right.
And so that's kind of, and after fellowship, I moved to New York, and
the rest is history.
Joined, programs in the city and basically started pioneering programs, because in the last 20 years, I think one of the biggest challenges has been, providing access to all the patients in all the different communities.
Right.
Right. I think that if you're in a big center in a big city, you may have access, but I think, one of the problems was that, if you didn't live within, 20 minutes of a major, comprehensive center, you wouldn't necessarily get the best care.
Right. And you're making a couple of great points, right? We're kind of spoiled today. Because there's a lot of structure behind creating a stroke center and a lot of understanding by shareholders like the hospitals and other providers about the value of a stroke center, a primary stroke center, thrombectomy capable or comprehensive stroke center. But back when you're describing kind of your role in starting those programs, a lot of it was trying to convince people that what you're doing is worth the effort of a hospital to rally behind you and build a program, right?
That's right.
And so now, to some extent, we're all spoiled. But I just want to point out, Jason, we have a tradition of bringing on board underachievers.
Always
underachievers. So Sundeep obviously did as many fellowships as there were on the book.
Yeah.
And so here he is. And so now your role will be to bring that expertise in Nassau County, whatever we're doing obviously in Suffolk County, but more in the Nassau space. and more specifically in one of our sister hospitals to Good Samaritan University Hospital, and that would be St. Francis Hospital. Is that correct?
That is correct. I'm excited about the opportunity, Kimon, to really expand, access in Nassau County.
That's awesome, and that's a challenging geography, a little different than Suffolk County, but of course you know it very well because that's pretty much the area that you've been practicing, and so
Yeah, for the last 5 to 10 years, I've been growing my practice in Nassau County, and I've really gotten to know the community, and I think that. As you said, Suffolk and Nassau are different,
Right.
but they share a lot of the same, values as communities, and the same, demographics as well.
absolutely. And as you said, it's all about access to this care, and our goal is to model the program that we were successful in launching in Suffolk County, to model that in Nassau County, and hopefully achieve comprehensive certification for St. Francis Hospital, and create another hub for neurosciences, and more narrowly in our field for stroke, brain aneurysms in that area. And so you'll be leading a lot of those clinical initiatives, but you also will be leading a lot of the research initiatives and innovation. Tell me how important innovation, I know our viewers don't, but I
Sure.
know that you're very passionate about innovation, but tell me how important innovation is and has been in your life and also in your future.
Thanks for asking that question, Kimon, because I agree with you. I think that everything that we are doing these days has been based on is on the backs and shoulders of the innovation that we've done over the last 20 to 30 years.
No doubt.
And there's mentors of mine, as well as myself and my teams, and our students and residents and fellows, as well as colleagues, that I think what we do is we make observations, and
Right.
we identify problems that we continue to have in terms of providing patients with the highest level of recovery and functionality, and we look for opportunities to improve it, and so that 1 year from now, 10 years from now, we're doing better. Patients are doing better.
Right.
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 And so I think by paying attention to where we are today and where we'd like to go tomorrow, I think we can really enhance care. And this is what we've done over the last 20 years. I
Right.
think that the kind of care that patients have now, compared to where we were 20 years ago, is dramatically different. And it's built on that research.
Right, and for me, it's extremely exciting to have somebody like you on the team, because you've seen the evolution. You are part of it. You pushed for the techniques and the methods that we're using today. You believed in them because, frankly, as you know,
Yes.
not everybody did. And my specialty is probably guilty of not believing in a lot of the innovation that happened in the endovascular space. And you stuck with it. And that speaks volumes to your character and determination and passion for this field, frankly, and we are extremely happy to have you on board. And with that, also kind of the innovation aspect, hand in hand, is also training, education, mentorship, and we do a fair bit of that in our everyday lives, of course. And I know you've done this through your several positions in the past, either at Columbia or upstate New York, or on Long Island even. And tell me a little bit about that, and how you find that exciting, and how does that motivate you?
Yeah, no, that's a great question. I think in terms of, education and mentoring, and it's not just medical students and residents, but I think it's talking to the community members of your care team.
Oh yes, no doubt.
Right.
That's key.
It's critical, because I think when you can engage your nurses, your techs, your team, on what's happening to the patients, what's happening in the disease processes, when you get full engagement, then not only do you get good results, it becomes fun working
Yes,
together.
absolutely.
Right, because now everybody's on the same team, pushing the car in the same direction,
Right.
and knowing why they're doing it.
Right.
And then I think the other big thing is that when you're sharing information, right, with everybody, right, you are now engaging their intelligence
Right.
and their perspective, and often what you will learn many things, based on the insights of people that that you may have a teaching role with, but actually, you become the student in many ways.
Oh, no doubt about it. I always say my team makes me look good, but I also learn from my team every day.
Yes.
And my patients, of course. But my team is the people I spend most of my time with. That's a very, very, very insightful. And kind of in the same vein, of course, you're joining. You're going to be joining the faculty at St. Francis Hospital, right? And the folks there, of course, a very, very strong tradition at St. Francis for cardiology, one of the meccas of cardiology in New York and in the country. Tremendous, tremendous tradition, great physicians, and a great hospital and mindset when it comes to quality, when it comes to research, when it comes to innovation. But of course, you'll be coming in as a neurointerventionalist, which is similar but very different than cardiology. And that's our role. Our role is to kind of plug and play, because what we do is, stroke is across the hospital, right? It starts in the emergency room. It can happen on the floor, but it requires coordination from everybody and buy-in from everybody in the hospital. So how do you envision yourself being part of that multidisciplinary team of multiple different people and trying to engage everybody? Of course, we always try not to be disruptive, but kind of work with everybody.
Yes.
But to some extent, change the culture to think stroke often and understand that we're there to help, not to impede in any other care.
Right. No, I think that's always a challenge when you start a new program or expand a new program.
Right.
And I think one of the keys, I think, is getting building relationships.
Right.
And getting people engaged, on a case by case, patient by patient basis, learning what are the challenges that the different caregivers and stakeholders have. I think listening, whenever you are trying to build a team, is one of the most first important steps. And then I think as you start to get an idea of how, and learn what they're doing well and what are their strengths and what are areas where they feel like they need help and support and what are their challenges, then I think enabling the team members themselves, to contribute to that, because I think it makes a big difference when everyone has buy-in, where they have recognize that there's a weakness or a challenge, and and they come up with the solution, right? And then when it's their solution, right, as opposed to someone dictating solutions to them,
Right.
I think that creates a long-term sustainable model.
You just touched on the holy grail of leadership, actually, which is to not dictate, but to create buy-in in that particular process. So where do you see, of course, our field is very exciting. It's still fairly new, despite the fact that it's been around for 20 years or so. But where do you see our field going? What do you think is going to be the next best thing, or the next procedure or disease process that we will tackle?
Yeah. No, I think we have a lot of exciting things on the horizon. And I think that as we've been focusing a lot on, kind of anatomic, morphologic modification of things. When it comes to stroke, we're just opening blood vessels.
Right.
When it comes to aneurysms, we're plugging up holes. Right?
That's right.
Right.
That's exactly right.
Right.
Folks.
Kind of the glorified brain plumber stuff that we do.
Yeah.
Right. But I think the next 10 to 20 years, in our field, I think we're going to be doing a lot more physiologic, biological modifications.
Okay.
I think that's going to be an area where, I think, working on the physiology of the brain, the brain tissue. I think as opposed to, dealing with, just reopening a plugged artery, it's like, okay, how can we revive ischemic, dying brain tissue, in stroke? How can we remodel the blood vessels so they heal across their, defects, and develop endothelium and things like that? And I think the other areas are going to be, in terms of making things safer and faster. Robotics. I think.
Right.
I think personalizing care. Finding the right patients to receive the right treatment instead of using kind of a one size fits all mentality. Right. And I think these are the areas where I think we're going to further make progress. We're going to find where we have persistent challenges, and then we'll be able to focus on those. right?
Right. Yeah, I think you're spot on. I share your optimism for the future and what you said about the different areas that we can expand. And for me personally, the things I'm looking forward the most is neuromodulation. Exactly what you said, affect physiology. Implanting stents, and maybe you're able to deal with paralysis and stimulate the motor cortex and being able to move again. Right. A lot of people are working on that. Of course, we know Neuralink is one of those not endovascular ways to treat and has a lot of publicity. But for our field,
Right.
we have a lot of excitement for clinical trials ongoing right now for endovascular treatments similar to that. And so I think that's definitely what the future looks like. And in my eyes, also probably we're going to have more sophisticated tools to also treat intracranial atherosclerosis. Probably
Yeah.
that's one of those things that we do treat, but rarely. Very specific indications. We had a great podcast here with Dr. Marisfoy about what the indications are today. But I think as we get more sophisticated with our devices, the stents we use, the balloons we use, and learning from our cardiac colleagues on how to get to those blood vessels and to the brain and deal with that. Yeah.
Yeah, no, I think we can do a lot of the things now, but I think the challenge is doing them, as you said, safely,
right.
and picking the right patients that need that treatment, because I think
Right, and also engaging imaging, actually. So we have a lot to learn, I think, from the way cardiology utilizes imaging inside the blood vessel. And I know that in the Stroke and Brain Aneurysm Center, we're doing a lot in terms of clinical trials and research when it comes to imaging and how we can optimize treatment, especially with atherosclerotic disease,
Yes.
because we're looking at a two-dimensional picture.
Yeah.
We're not looking at a three-dimensional picture. We want that immediate feedback. We treat a lot of atherosclerosis. We treat as much atherosclerosis as cardiologists, frankly, from the neck all the way up into the brain.
That's right.
And so getting more sophisticated with imaging, I think, is where
Right.
the future lies, honestly.
No, and I think that it's still a major problem.
Yeah.
I think that medical therapy has gotten better over the years,
Right.
right. But the stroke burden related to intracranial atherosclerotic disease remains very high. And we need new treatments. We need
Right.
new strategies.
Right. And so, what are your your goals in the first couple of months as you're going to be taking on this new role? And probably for you, it's been there, done that type
No.
of environment. But what are your priorities as you're considering kind of this new role and
Yeah.
expansion into Nassau County for us?
Yeah, no, I'm excited. And what I'm looking forward to is meeting, kind of the teams that are there, and in assessing, what are the strengths of the programs, and figuring out where is it that we can contribute,
Right.
and to take that next level, that next step, to becoming, kind of the world-class, institution of choice,
Right.
Right. For our community in Long Island, and then how to leverage, all of the, the expertise and talent that we have that we're building,
Right.
To move to the next level.
One thing I think that you do very well and is your patient-centered care.
Yes.
Can you tell us a little bit? I know that our listeners, being patients,
Yes.
that can make a big difference. Can you elaborate on that?
Yeah, of course, Jason. No, that's a great point. I think one of the things that I found over the years, and I've gotten better at it. I think as I've matured, is recognizing that patients have a real challenge navigating the system, right? And they don't often have good advocates for themselves, and they're not maybe necessarily equipped to advocate for themselves,
Right.
And so, I think it's really important, for the patients and for their families, to be at the center of every patient care paradigm.
Encounter, yeah.
Right. And I think I find that, being able to communicate, relate with patients and their families in their unique situations, it provides, them with the resources, to be able to, to care for themselves. Right, and we're partners in their care.
Mm-hmm.
I can't cure anything, and they can't cure anything by themselves either.
Right.
And so I think
We all need each other.
right. So we need each other, right? and it's a real it's a real scary experience being a patient,
No question.
right? And I think that by being the advocate, by being their doctor, right? Helping them navigate all of the challenging, I think bureaucratic and corporate kind of things that have evolved over,
And
out
exist.
of they exist. It's out of necessity at some level.
Yeah.
But I think patients get lost,
Right.
and I think being their advocate, and centering it on them and their needs, just makes their journey better, and also I think improves their outcomes, and I think their well-being. I think that frustration of dealing with all the phone calls and
Right.
getting an appointment, and all the paperwork that gets. I think as physicians and as caregivers, I think we can't avoid all that stuff.
Right.
Right, but
We would love to.
right.
Yeah. There's
But
there's
can-
no way out.
There's no way out, but we can advocate for them.
We can make it seamless. You're right, because
Right.
we do know the process. We understand it, of course, better because it's our life, and so we can make it so that it's easier for them, and
Right.
make them, like you say, shareholders and participants in the decision making and a bunch of other stuff.
Right.
I must say, even before we worked together, I was very impressed by your ability to explain things to patients. I've seen some of your patients myself, and I saw how humble you were, A, and B, how you were putting a lot of emphasis in the patient being a substantial member and shareholder in the decision-making process. It wasn't, I would never see a patient that said, oh, Dr. Mangla said, I need to have this procedure done. It was more so that he told me these are my options, and these are the pluses and minuses, and you were not scared to engage colleagues and talk about options. And I thought that's very rare in our field. Obviously there's a lot of egos when it comes to what we do, and certainly refreshing, and certainly somebody that belongs to the Stroke and Brain Aneurysm Center of Long Island.
For sure. I think every one of our physicians, and I'm proud to say this, really puts the humanity in healthcare.
Yeah.
Right.
Puts the people first, and that's important, and that's fantastic.
Yeah. I think it's, I thank you for the kind words. No, I think it's important. I think it's something that I think you learn, as you gain experience. Because I think early on people get caught up with just doing the work.
Right.
And then the patient sometimes gets lost.
Yeah.
Right.
Oh, no question.
Right. But
No
I think
question.
that, but as you have more experience and you take care of more people, you realize that, wait, these are, it's about the person. It's not about the operation.
Right,
Place.
right. No question. No question. That we say that all the time.
Yeah.
As a matter of fact, we've done even videos discussing that this is somebody's mother, father, so we've been really aggressive about spreading this message. Well, that's really awesome. So Sundeep, thank you again. This was just a short introduction to our viewers and our listeners. I'm sure you're going to be extremely successful in St. Francis and Nassau County. The folks in Suffolk, of course, know that the destination for stroke, brain aneurysm, and cerebrovascular care is the Stroke and Brain Aneurysm Center of Long Island. And with folks like you leading the charge in Nassau County, I'm sure they'll understand that very quickly, that's the case also there. Again, we're very excited for what's to come.
Thank you for the opportunity, to you and Jason. I think that the models that you guys have built out here in Suffolk County, I'm very impressed, and I'm really looking forward to learning from you and figuring out how we can translate the models of care to a broader community.
Awesome. Thank you, Sundeep. And thank you guys for watching. Please feel free to like and subscribe, and we'll catch you again in another video. Thank you.
Thank you.